Hello everybody, this is Greg Stock, CEO of Thibodaux Regional Health System. It's my pleasure today to introduce Dr. Hadi Elias.
Thank you.
Dr. Elias is an interventional cardiologist. Well, Dr. Elias, tell us just a little bit about yourself, your training, so forth.
Well, thank you for having me. My name is Hadi Elias. I was born in Iraq. We moved in the 90s to the States. And I've been living in Northern Virginia, or was living in Northern Virginia ever since. I did my residency training at St. Agnes Hospital in Baltimore, Maryland, and then went on for my cardiology fellowship training and interventional cardiology fellowship training in Danville in central Pennsylvania.
That's awesome.
Yeah.
What kind of things does an interventional cardiologist do that makes them different?
Yeah. So as an interventional cardiologist, you're actually a general cardiologist first. So you do take care of patients in your clinic. You care for high blood pressure, their cholesterol, if they have high cholesterol, if they had a heart attack, or if they have any valve issues, or if they have heart failure. Unfortunately, heart disease is still the number one killer here in the Western world. And the number one cause of that is having coronary artery disease, which is having a blockage in one of your heart arteries. So as an interventional cardiologist, what we do is we take patients who've had blockages in their artery, or most of them will come with either chest pain, shortness of breath. So once we actually define that somebody probably has heart artery blockage, then we take them to the cath lab to do what's called a coronary angiogram. To do this coronary angiogram, we usually go either through the wrist, the artery here, or through the groin. We stick a tube in there, and then through the tube, we advance another tube and a wire that goes all the way to the heart. It is minimally invasive. Most patients, if they come in the outpatient setting, they actually can leave in the same day. They don't have to stay in the hospital. The other major advantage is if we do find a blockage, we're right there, we can actually fix it for them.
And that's the interventional part.
That's the interventional part.
Find out what the problem is and then open the blood vessel or whatever that might require. Great stuff.
Yeah.
Advanced stuff, and it's getting better all the time. It's awesome. And you're trained in all those things.
I am.
So you're capable, and so we want to welcome you once again to Thibodaux Regional and our family of doctors. Thibodaux Regional this year was recognized as the #1 heart program in Louisiana. And that's by a company called CareCheck. It's a legitimate company that rates hospitals based on a list of factors, outcomes, that if you score at the highest, you can get into that category. It's not based on taking one little thin strip, one thin slice of that and saying, we're the best at this. Wow, but you might not be so good at a bunch of other things. So that's an overall heart program that's #1 in Louisiana. Thibodaux Regional, Dr. Hadi Elias, great young guy that's joined us. Thank you for your time today.
Thank you. Thank you for having me.